Hello, my name is Kathleen Costello. I'm the Associate Vice President for Healthcare Access at the National MS Society. I have over 30 years of experience as a nurse practitioner in MS care and currently have a small practice in the Multiple Sclerosis Center at the Johns Hopkins Hospital in Baltimore, Maryland. Today we're going to talk about MRI, how it's used in the diagnostic process for multiple sclerosis, and how it's used to help with ongoing monitoring and response to disease-modifying therapies. So let's start with what is MRI. And this is an important imaging tool. It uses a strong magnet and radio frequency pulse to generate a very detailed image of body structures, of tissues within your body. It also is able to identify abnormal areas, such that we would see in a disease like multiple sclerosis. So when you lie in the tube of an MRI, your protons that are associated with water line up in the direction of the magnetic field. A radio frequency pulse then is sent across that field, which causes the protons to move. They release energy, which is captured by a computer and translated into a very detailed image. In MS, we're able to differentiate lesions or areas of abnormality from other types of illnesses that would have a different appearance on the MRI. So if you are suspected of having multiple sclerosis, meaning you have a history of symptoms that are referable to the central nervous system, the brain and the spinal cord, and you have a neurological exam that points to a problem in the central nervous system, you will likely be asked to have an MRI. So we will be looking then for specific areas of abnormality associated with MS. You may also have an MRI of the spinal cord, because the spinal cord and the brain are all part of the same system. This is all part of the central nervous system. Sometimes an MRI of the spinal cord isn't done. It may be done later on. Recommendations from the Consortium of Multiple Sclerosis Centers indicate that doing a spinal cord MRI, particularly of the neck or cervical spine, may be important early on because it can help identify silent lesions, those areas of abnormality that have not produced a symptom for you. Once a diagnosis is made, an MRI is not the only thing that makes the diagnosis. Diagnosing MS is putting together the pieces of a puzzle: your history, the neurological examination, the findings on the MRI, but then lots of lab work that excludes other conditions that may mimic multiple sclerosis. So once the diagnosis is made, it's likely that you'll be recommended to be on a disease-modifying therapy. Once you start on that therapy, part of the monitoring will be doing repeated MRIs at intervals to assess underlying activity that may represent ongoing disease activity. So about 6 months or so after you start a disease-modifying therapy, you may be asked to have another MRI. And that may then proceed on a yearly basis to assess for subclinical or underlying activity that has not produced a symptom. At that time, you may or may not have an MRI of the brain and the spinal cord. Usually it's done just of the brain, but if there are ongoing symptoms that are referable to the spinal cord, then a spinal cord MRI will be done. Sometimes after someone has had MS for a period of time, they have an MRI and the results indicate that there's no change. Yet the individual says, but I'm worse. Why is my condition changed, yet my MRI is the same? And over time there can be a disconnect between what the MRI shows us and what the person is feeling, because those lesions that are there may have ongoing changes that take place without having any new lesions at all. Someone may experience worsening of their symptoms despite having no change in the number of lesions on the MRI.